Republican senators still working to repeal and replace Obamacare. Many people are left wondering what the possible changes could mean for their health care plans. But health insurance isn't the only thing that could be affected. Let's talk about something no one talks about, dental insurance. Dental insurance could see changes as well. Here to talk about some of those changes is dentist Tim Garofalo. Nice to have you here, doctor.
Thank you.
All right, so we never talk about dental insurance. Why?
Well, it's one of those things that just kind of goes untalked about, like you said.
Yeah.
Everyone's concerned about health care, but dental insurance normally isn't combined with health care. So we find that employers, as they do offer it, there's still about 1 in 3 Americans right now that do not have dental coverage.
And of course, poor dental hygiene can contribute to all kinds of medical problems, right?
Yeah. Dentistry, it's best if you're preventative. And as we age, the oral manifestations can grow and cause a lot of problems in the body. 67% of patients without dental care can form heart disease, and 30% can form diabetes. So it's real important to stay on top of it.
So what, as you look at the Obamacare situation and the covered California care situation that we have here in California, what recommendations would you give to people who are concerned about what dental care to choose or to buy?
Well, there's a lot of information online on ADA.com. That's one of the main resources. And what we're finding now is that you can get coverage through private sector insurance plans. That number is actually on the rise. It was about 2% of dentists or of people with dental coverage had private insurance. Now that's up to about 7%. So as employers are decreasing the amount of insurance that they're offering, that means that it's up to the consumer to get their own dental insurance.
Let's talk about affordability, because dental care, I know a lot of these policies only cover some preventative easy stuff like teeth cleaning and
right.
an early exam, but none of the procedures that follow that. So what's going on as far as getting that so that it's at a manageable level for a person who wants to be insured?
Yeah, that's one of the big concerns. Is you're talking about more extensive procedures like root canals, implants.
Right,
yeah, almost.
Those things are expensive. Yeah.
Yes, yeah, they can add up. That's why we always push prevention. If you can start at an earlier stage before you need those types of things, the costs can stay relatively low. I think the average American spent about $540 with dental insurance on dentistry per year. I think that was 2016's average. So, but yes, you get. Some of those plans only cover up to $1,000 to $1,500 a year, so that's only $1 crown, and you've used your max. So
you have your practices in Rancho Bernardo, and what kinds of things are your patients telling you about the dental insurance?
Well,
biggest concerns.
Yes. Well, a lot of patients have either lost their dental coverage, or the fact that the dental insurance won't cover, like you said, the larger procedures. We've listened to them, and we've actually developed our own benefit plan, which patients are really happy with. A lot of patients have either switched to it, or if they didn't have insurance, they got it. And that does include prevention, a couple cleanings, x-rays, and then a discount on most procedures. So patients are really happy with that.
Your own practice has created this?
Yes.
And
yes.
a lot of dentists and a lot of doctors are starting to do that, right? In light of what's happened with all of this.
Yeah, in dentistry, we kind of have to take it into our own hands, and we feel that's the best way for us to impact our surrounding community is by offering affordable dental care. And patients have really, they've responded well to it, and they're real appreciative of it, and we're happy to offer it.
Dr. Garofalo, thanks so much for being here this morning. And we'll connect to that website information that he has on this plan that he has as an office on KUSI.com. Thanks so much for being here with us.
Thank you.
Good to see you. All right, we'll be right back with more Good Morning San Diego in just a moment.